Today, we're diving into the fascinating world of Narcissistic Personality Disorder, or NPD. Get ready to explore the psychology behind this complex disorder. We'll uncover its hidden depths and shed light on its often misunderstood nature. Narcissism is often thrown around casually, but NPD is a serious condition. It affects how people think, feel, and interact with others. We'll break down the intricacies of NPD and look at its impact on individuals and their relationships. This journey is all about increasing awareness and fostering understanding and empathy. So whether you've personally encountered NPD or simply want to learn more, buckle up. Let's unravel the layers of narcissistic personality disorder and gain valuable insights into this complex condition. And narcissistic personality disorder goes beyond having a big ego. It's a deeply ingrained pattern of behavior that affects a person's thoughts, feelings, and actions. This disorder is characterized by a constant need for admiration. People with NPD often have a grandiose sense of self-importance. They may have fantasies of unlimited success and power. This inflated self-image often masks underlying feelings of insecurity and vulnerability. They might demand constant attention and praise and can become enraged by criticism, even if it's constructive. A lack of empathy is a hallmark of NPD. Individuals with this disorder struggle to recognize or understand the feelings and needs of others. This can lead to difficulties in forming and maintaining healthy relationships. It's important to note that NPD is a spectrum disorder, meaning its severity can vary greatly from person to person. Let's look beyond the surface and understand the specific symptoms of NPD. Remember, these symptoms are persistent patterns of behavior. They're not just occasional occurrences. One of the most prominent symptoms is a grandiose sense of self-importance. People with NPD often have an exaggerated belief in their abilities and accomplishments. They may see themselves as superior to others, overestimate their talents, and minimize the achievements of those around them. This inflated self-image can manifest in various ways. They might dominate conversations, constantly steering the topic back to themselves. They might name drop or exaggerate their connections to impress others. Another key symptom is a constant need for admiration. Individuals with NPD crave validation from others. They need constant reassurance about their worth and importance. This need for admiration can be insatiable and often drives their interactions with others. They might fish for compliments and may surround themselves with people who constantly praise and validate them. Empathy, the ability to understand and share the feelings of others, is often lacking in individuals with NPD. Grandiosity is a core feature of NPD. It's more than just arrogance or vanity. It's a deeply ingrained belief in one's own exceptionalism. This belief permeates their thoughts, feelings, and behaviors. People with NPD often have an inflated sense of their accomplishments and talents. They may exaggerate their achievements or claim to possess unique skills and abilities. This exaggerated sense of self can lead to unrealistic expectations. They might set goals that are far beyond their reach. They might feel entitled to special treatment or privileges. When these expectations aren't met, they might react with anger, frustration, or even rage. They have difficulty accepting criticism. Even constructive feedback can be perceived as a personal attack. They might become defensive, argumentative, or dismissive when confronted with their flaws. This grandiosity can create significant interpersonal problems. Their sense of superiority can alienate others. Their lack of empathy can make it difficult to form genuine connections. The need for admiration is a driving force in the lives of individuals with NPD. This need stems from a deep-seated insecurity and a lack of self-worth. To compensate for these feelings, they seek constant validation from others. They need to feel special, admired, and envied. This craving for admiration can manifest in various ways. They might engage in attention-seeking behaviors. They might boast about their accomplishments, exaggerate their talents, or try to outdo others. They might be overly concerned with their appearance and status. They might seek relationships with people who constantly praise and admire them. They might become enraged or withdraw when they don't receive the admiration they crave. This constant need for validation can be exhausting for those around them. It can create an imbalance in relationships, where one person's needs are constantly prioritized over the others. it's important to remember that beneath the surface of grandiosity and the hunger for admiration lies a deep sense of insecurity. Narcissistic personality disorder can have a devastating impact on relationships. Individuals with NPD often struggle to form and maintain healthy, fulfilling connections with others. Their need for admiration, lack of empathy, and manipulative tendencies create an imbalance in relationships. This imbalance can lead to significant distress for their partners, family members, and friends. People with NPD often have a distorted view of relationships. They may see others as objects to be used for their own gratification. They may struggle to understand or reciprocate the emotional needs of their loved ones. This lack of empathy can make it difficult to build intimacy and trust. Their partners might feel emotionally neglected, unappreciated, and unheard. The constant need for admiration can also take a toll on relationships. Individuals with NPD might demand constant praise and attention from their partners. They might become jealous and possessive if their partner shows interest in others. This can create a stifling and suffocating environment for their loved ones. Romantic relationships with someone with NPD can be particularly challenging. The initial stages of the relationship might be intense and passionate. The narcissistic individual may shower their partner with attention, affection, and grand gestures. However, as the relationship progresses, the narcissistic traits become more apparent. The need for admiration might lead to controlling and manipulative behaviors. They might try to isolate their partner from friends and family. They might use emotional manipulation to keep their partner invested in the relationship. Gaslighting, a form of psychological manipulation, is a common tactic used by individuals with NPD. They might deny their partner's reality, make them question their own sanity, and undermine their self-esteem. This can leave their partners feeling confused, insecure, and emotionally drained. It's important to remember that individuals with NPD are often unaware of the harm they inflict on others. Their distorted self-image and lack of empathy make it difficult for them to recognize the impact of their behavior. Narcissistic personality disorder can also significantly impact professional settings. Individuals with NPD might excel in certain areas, such as leadership or sales, where their charisma and self-confidence can be advantageous. However, their narcissistic traits can also create a toxic work environment. Their need for admiration might lead them to take credit for others' work, micromanage their colleagues, and sabotage the success of those they perceive as threats. They might be highly critical of others while being hypersensitive to any form of criticism themselves. This can lead to conflicts, resentment, and decreased morale among team members. Their lack of empathy can make it difficult for them to build strong working relationships. They might struggle to understand or respond to the needs and perspectives of their colleagues. This can hinder collaboration and teamwork, ultimately impacting productivity and success. Dealing with a narcissistic colleague or boss can be challenging. It's important to set boundaries, document their behavior, and seek support from HR or trusted mentors. Remember, you deserve to work in a respectful and supportive environment. Diagnosing narcissistic personality disorder is a complex process. It requires a comprehensive evaluation by a qualified mental health professional. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, provides a set of criteria to guide this evaluation. The DSM-5 criteria outline specific patterns of thoughts, feelings, and behaviors that are characteristic of NPD. These criteria ensure a standardized approach to diagnosis. This helps clinicians make accurate assessments. It's important to note that self-diagnosis is not recommended. NPD is a complex disorder. It should only be diagnosed by a trained professional using the DSM-5 criteria. The criteria help distinguish between traits associated with NPD and other personality disorders. This ensures individuals receive appropriate treatment and support. According to the DSM-5, an individual must exhibit at least 5 of the 9 criteria to receive a diagnosis of NPD. These criteria encompass various aspects of narcissistic personality traits. They provide a comprehensive framework for assessment. The criteria include a grandiose sense of self-importance, a preoccupation with fantasies of unlimited success, a belief in one's uniqueness, a need for excessive admiration, a sense of entitlement, interpersonally exploitative behavior, a lack of empathy, envy of others, and arrogant and haughty behaviors. These criteria are not meant to be a checklist. Instead, they should be considered in the context of an individual's life experiences, cultural background, and overall functioning. The presence of these traits must be persistent and pervasive. They should significantly impair an individual's relationships, work, or other areas of life. While the DSM-5 criteria are essential for diagnosis, it's crucial to remember that NPD is a spectrum disorder. Individuals with NPD can present with a wide range of symptom severity and functional impairment. Some individuals might exhibit only a few narcissistic traits. These traits might have a relatively minor impact on their lives. Others might have a more severe form of the disorder. This can lead to significant interpersonal problems, difficulty maintaining employment, and other challenges. Therefore, it's essential to look beyond the label of NPD and focus on understanding the individual's unique experiences and challenges. Each person with NPD has their own story, their own triggers, and their own way of coping with their condition. Treatment should be tailored to the individual's specific needs and goals, addressing the underlying causes of their narcissistic behaviors and helping them develop healthier ways of relating to themselves and others. The development of narcissistic personality disorder is a complex interplay of nature and nurture. It's not a simple case of one factor causing the disorder. Researchers believe that both genetic predisposition and environmental influences contribute to its development. Some individuals might be genetically predisposed to certain personality traits. These traits might make them more susceptible to developing NPD. These traits could include a tendency towards impulsivity, a heightened sensitivity to rejection, or a strong need for admiration. However, genetic predisposition alone doesn't determine whether someone will develop NPD. Environmental factors play a crucial role in shaping how these predispositions manifest. Early childhood experiences in particular are thought to be significant in the development of NPD. Traumatic events such as abuse or neglect can have a profound impact on a child's sense of self and their ability to form healthy attachments. Childhood experiences that can contribute to the development of NPD often involve extremes in parenting styles. Some children who develop NPD might have experienced excessive pampering or indulgence. They might have been constantly told they were special, superior, or entitled to special treatment. While this might seem positive on the surface, it can prevent a child from developing a realistic sense of self and healthy coping mechanisms for dealing with challenges and setbacks. On the other hand, some children who develop NPD might have experienced emotional neglect or criticism. They might have grown up in an environment where their emotional needs were ignored or invalidated. They might have been constantly criticized, belittled, or held to unrealistic standards. This can lead to deep-seated feelings of inadequacy and a belief that they need to prove their worth to others. In both scenarios, the child doesn't receive the consistent love, support, and validation needed to develop a secure sense of self and healthy self-esteem. This can create a vulnerability to developing narcissistic traits as a way of coping with these underlying feelings of insecurity and shame. It's important to remember that not every child who experiences these types of parenting styles will develop NPD. Similarly, not everyone with a genetic predisposition to certain personality traits will develop the disorder. The development of NPD is a complex process. It likely involves a combination of genetic vulnerability and environmental stressors. Researchers are still working to fully understand the intricate interplay between these factors. However, by examining the potential contributions of both nature and nurture, we can gain a deeper understanding of the origins of this complex disorder. This understanding is crucial for developing more effective prevention and intervention strategies. It also helps to foster empathy and compassion for individuals struggling with NPD, recognizing that their behaviors often stem from deep-seated pain and insecurity. Treating narcissistic personality disorder can be challenging, but it's not impossible. It requires a multifaceted approach tailored to the individual's specific needs and challenges. The first step is often acknowledging the need for help. This can be difficult for individuals with NPD, as their inflated self-image might make them resistant to recognizing their own vulnerabilities. However, with the right support and encouragement, many people with NPD are able to engage in therapy and begin the journey towards healing. Therapy for NPD typically focuses on helping individuals develop greater self-awareness, empathy, and healthier coping mechanisms. Therapists often work with individuals to identify the underlying causes of their narcissistic behaviors, such as early childhood experiences or trauma. By understanding the root of these behaviors, individuals can begin to challenge their distorted self-image and develop more realistic expectations of themselves and others. Several types of therapy can be effective in treating NPD, depending on the individual's needs and preferences. Cognitive behavioral therapy, or CBT, is often used to help individuals identify and change negative thought patterns and behaviors. CBT can help people with NPD challenge their grandiose beliefs, develop more realistic self-perceptions, and learn healthier ways of interacting with others. Psychodynamic therapy, on the other hand, focuses on exploring unconscious conflicts and motivations that might be driving narcissistic behaviors. This type of therapy can help individuals gain insight into their early childhood experiences and how these experiences might have shaped their personality. Schema therapy combines elements of CBT, psychodynamic therapy, and attachment theory to help individuals identify and change maladaptive patterns of thinking, feeling, and behaving that developed early in life. Schema therapy can be particularly helpful for individuals with NPD who experience significant emotional neglect or trauma in childhood. If you've been in a relationship with someone with NPD, you might have experienced narcissistic abuse. This type of abuse can be emotional, psychological, verbal, or even physical. It can leave you feeling drained, confused, and questioning your own sanity. Recognizing the signs of narcissistic abuse is the first step towards breaking free. These signs can include gaslighting, manipulation, isolation from friends and family, constant criticism, and a lack of empathy or remorse. It's important to remember that you are not to blame for the abuse. Individuals with NPD are responsible for their own behavior. Leaving a relationship with someone with NPD can be challenging, as they might try to control or manipulate you into staying. It's essential to prioritize your safety and well-being. Seek support from trusted friends, family members, or a therapist. They can provide you with the emotional support and guidance you need to navigate this difficult time. Recovery from narcissistic abuse takes time and effort. It's essential to be patient with yourself and focus on self-care. This might include therapy, support groups, journaling, spending time in nature, engaging in hobbies, or anything else that brings you joy and helps you reconnect with yourself. Therapy can play a crucial role in healing from narcissistic abuse. It can provide a safe and supportive space to process your experiences, develop healthy coping mechanisms, and rebuild your self-esteem. Support groups can also be incredibly beneficial. Connecting with others who have experienced narcissistic abuse can help you feel less alone and provide a sense of community and understanding. Remember that you are worthy of love, respect, and healthy relationships. By prioritizing your well-being and seeking support, you can move on from narcissistic abuse and create a brighter future for yourself. So there you have it, our deep dive into the often misunderstood world of narcissistic personality disorder. We've covered a lot, from the symptoms and impacts to the causes and treatment options. It's clear that NPD is a complex disorder, rooted in deep-seated feelings of insecurity and a distorted sense of self. Those with NPD often struggle to form healthy relationships. They may struggle in various areas of their lives. But remember, beneath the mask of grandiosity and the need for admiration, there's often a wounded person longing for validation they never received. Understanding this is key. It's not about excusing harmful behaviors, but fostering empathy. This allows for a more compassionate approach to supporting those affected by NPD. Remember, NPD is a spectrum disorder. its severity and impact can vary greatly. While some individuals might exhibit a few narcissistic traits, others might experience significant impairment in their daily lives. The good news is that recovery is possible. With the right support, individuals with NPD can learn to challenge their negative thought patterns. They can develop healthier coping mechanisms. Therapy plays a crucial role in this journey, providing a safe and supportive space for individuals to explore their inner world and develop healthier ways of relating to themselves and others. If you've been affected by NPD, whether personally or through a loved one, remember that you're not alone. There are resources available to help. Seeking therapy for yourself can be incredibly empowering. It provides you with the tools and support to navigate the challenges of NPD and build healthier, more fulfilling relationships. Remember, knowledge is power. By understanding NPD, we can challenge the stigma surrounding mental health. We can foster a more compassionate and supportive world for everyone. Thanks for watching and take care of yourselves.